In the second section of our lecture, normal and abnormal puberty, we will talk about the condition which is known as precocious puberty. And in precocious puberty, we will talk about what is precocious puberty, what are the types of precocious puberty, etiopathology and McCune-Albright syndrome versus premature thelarchy and premature pubarchy. Precocious puberty is appearance of physical and hormonal signs of puberty at an early age than is considered normal. So when the puberty is reached early or when the changes of puberty start early, that's known as precocious puberty. You see in this diagram, the breast tissues are developing, the thighs are, or the hips are more like a pubertal girl. So these are some diagrams or pictures that shows the precocious puberty. Types and causes of precocious puberty, we have depending on gonadotrophin releasing hormone dependent, which is about 80%. 80% of precocious puberty is due to gonadotrophin releasing hormone, which is constitutional. And then we have intracranial lesion that cause production of gonadotropin releasing hormone. And these intracranial lesions can be due to trauma, tumor, infection. Then we have juvenile primary hypothyroidism. Juvenile primary hypothyroidism is low level of thyroid hormone occurring at the young age. That's also cause of precocious puberty, and it's gonadotropin releasing hormone dependent type of precocious puberty. It can be incomplete, in which we have premature thelarchy, premature pubarchy, and we have premature menarche. Then gonadotropin releasing hormone independent type of precocious puberty, we have ovary factors, which is the granulosa cell tumor, theca cell tumor in the ovary, and Leydig cell tumor of the ovary. We have chorionic epithelioma of the ovary, and then androblastoma. McCune-Albright syndrome. Then we have adrenal causes, in which we have adrenal hyperplasia, tumor, and then liver factors are hepatoblastoma. These are some types and causes of the precocious puberty. Causes, mainly the cause of precocious puberty in 80% of the cases is gonadotropin releasing hormone dependent, which is 80%, and we further subdivided into juvenile primary hypothyroidism, constitutional intracranial lesion, and incomplete. Then we have gonadotropin releasing hormone independent, which are due to ovary factors, adrenal factor, liver factor, and iatrogenic. Iatrogenic are self-induced, which is due to estrogen and androgen intake. So all these are the different types and causes of precocious puberty. Etiopathology is constitutional factors, intracranial lesion, in which we have McCune-Albright syndrome. Then we have premature thelarchy, premature pubarchy, and premature menarche. These are all the pathologies of the precocious puberty: constitutional, intracranial lesion in which we have McCune-Albright syndrome, premature thelarche, premature pubarche, and premature menarche. Now, the constitutional factors, again, mainly due to the, as we talked about, the hormonal factors leading to the puberty, any abnormalities that can lead to those imbalances, like we have sex steroids, which cause gonadal sensitivity to follicle stimulating hormone and luteinizing hormone, FSH, LH, secreted, then act on the pituitary hormone, which in turn affects the gonadotrophic releasing hormone. So all these are the factors that can lead to the production of gonadotropin releasing hormone, and then gonadotropin releasing hormone is the main cause of precocious puberty. It's about 80% of the cases. McCune-Albright syndrome is a syndrome that's diagnosed with cafe au lait spots or cafe au lait lesion. Patient has fibrous dysplasia and precocious puberty. So it's a syndrome. Syndrome is a condition when there are more than 2 or 3 symptoms associated. So in this we have cafe au lait spot, which are white brown spots, fibrous dysplasia. Fibrous is the disease of the skin and bones, and there is dysplasia of the bone also, and there are lesions on the skin known as cafe au lait lesion. And there is also precocious puberty in McCune-Albright syndrome. Premature thelarche. Premature thelarche is, in this there is isolated development of breast tissue before the age of 8 and commonly between 2 and 4 years of age. So at young age you see there is development of the breast tissue. This is premature thelarche. Either one or both breast tissues may be involved, and no other feature of precocious puberty is present. So premature thelarche is the early growth of breast tissue, can be unilateral or bilateral, and there is no other feature of precocious puberty. Generally requires no treatment. And then we have premature pubarche, is isolated development of axillary or pubic hair prior to 8 years of age without other signs of precocious. So as the name shows, precocious thelarche is the premature thelarche is breast development, pubarche is pubic hair and axillary hair growth without any other sign of precocious puberty. And there is usually due to increase of adrenal androgens to level normally seen in early puberty. So increase in the level of androgen and normal adrenal androgen level for age, usually due to hypersensitivity of the pilosebaceous unit to androgen. So one with the increased level of androgen, one with the normal level of androgen. And in this normal level of androgen, there is hypersensitivity of pilosebaceous unit to androgen. Normal androgen is present, but it's hypersensitivity to androgen that leads to premature pubarche. That was all about the premature pubarche, thelarche, and we talked in second section in detail about these two things. Thank you for watching sqadia.com.